This is Kristina Fiore of MedPage Today, reporting from the ADA meeting in San Diego. In type 1 diabetic patients, teplizumab didn't improve glycemic control or lower insulin dose, according to early findings of the Protégé trial. But during a press briefing here, senior author Dr. Nicole Sherry of Massachusetts General Hospital said the monoclonal antibody may preserve beta cell function.
The primary outcome did not differ among groups at 1 year. In the 14-day full-dose group, 19.8% met the composite endpoint at 1 year, compared to 20.4% in the placebo group, so about equal. However, importantly, exploratory analyses suggest that the 14-day full-dose regimen preserves C-peptide with a P of 0.046 at 1 year. Additionally, 5% of patients did not require insulin at 1 year in the teplizumab groups, with no patients off insulin in the placebo group at 1 year, with a P of 0.03. In addition, the percentage of patients requiring very, very low doses of insulin, doses of less than 0.25 units per kilo per day, and retaining glycemic control with an A1C of less than 7%, was greater compared to placebo at 1 year, with a P of 0.006.
Certain subpopulations may garner additional benefits.
We notice particular benefit in children ages 8 to 11 years. And this is an important finding because the management of diabetes in children is very challenging, with higher rates of hyper as well as hypoglycemia. As well, also, patients who began treatment especially early, so within 6 weeks of diagnosis compared to within 12 weeks for the whole population, also had a greater benefit. Lastly, we noticed regional differences, with patients in the U.S. demonstrating a greater treatment effect.
Sherry also emphasized that the therapy was well tolerated.
Across the 4 study groups, a similar proportion of subjects experienced adverse events, 99% in the teplizumab groups versus 99% in the placebo groups, and the same rate for serious adverse events, 10% in the teplizumab groups versus 9% in the placebo groups. The most common clinical adverse event in the teplizumab groups was rash, 53% in the teplizumab groups versus 20% in the placebo groups. It was generally macular-papular, often pruritic, and self-limited. We also saw transient decreases in white cell counts, especially lymphocyte counts. However, there was no significant decrease in infections across the groups.
Dr. Sherry said the findings suggest that there is indeed a biological effect of teplizumab in this population, and it may be best for certain subgroups like children and the very recently diagnosed. At the ADA meeting in San Diego, I'm Kristina Fiore, MedPage Today.